Case report. A 42-year-old male named Indigo Montoya was referred to endocrinology clinic today. Hispanic male, 5 feet and 11.5 inches, weighed 208 pounds. Montoya received an injury in his right lower abdominal quadrant and right brachial pelvis during a sword fight to avenge his father's death in 1987. He suffers from chronic pain as a result of injury from sword fight. His pain is not being treated with neither anti-inflammatory corticosteroids or anticonvulsants. As a result of this, 4 months ago, Indigo was given a 4.2 milligrams per day transdermal fetal patch. Indigo came to my office today complaining of fatigue and sexual evasion disorder and impotence, erectile dysfunction for the first time. No physical abnormalities were found in the penis, testicle, or perineal area. No alopecia in inguinal region is visible. A digital rectal exam of the prostate was performed and findings were unremarkable. Laboratory prostate-specific antigen tests were performed here. His PSA and prostaglandin levels are normal, and upon being asked, Mr. Montoya reports new polyuria, absence of nocuria, and urine problems in general. Mr. Montoya has no appreciable past history except of the third fight in 1987. He has been also treated with gabapentin and clonazepam unsuccessfully. His blood pressure upon admittance was 128/72 and heart rate was 72 beats per minute and body temperature was 89.6 degrees Fahrenheit. Radiography of the thorax and as well as electrocardiogram were normal. Routine urinary tests were normal except for slight anemia. Morning starting at 8 a.m. Endocrine examinations including thyroid stimulating hormone, triiodothyronine T3 and thiacamxin T4, thyroid levels and insulin-like growth factor 1 were all within normal ranges, and as were prolactin, adrenocorticocalyc cortisol and urinary cortisol were all within normal levels. On the other hand, serum luteinizing hormone and follicle stimulating hormone, total testosterone, hypotestosterone, and free testosterone were all decreased below normal levels. Hormone stimulating tests including thyroxine releasing hormone, Corticotropin releasing hormone and growth hormone releasing peptide 2 showed very normal reactions to thyroid stimulating hormone. Adrenocaptochronic hormone, cortisol, and growth hormone, respectively. On the other hand, luteinizing hormone stimulating test produced a delayed reaction to fascicle stimulating hormone. These findings are consistent with hypogonadotrophin hypogonadism, enhanced magnetic resistance imaging of the hypothalamus and the pituitary gland found no abnormal findings. He had no past history of traumatic brain injury, cranial radiation, glucosteroid treatment, and metabolic syndrome can be ruled out for hypohydrolic hypergolism. Furthermore, his hypogonadotrophic syndrome, such as hyperactive sexual desire disorder and erectile dysfunction, appeared only after taking the transcendental phenol patch. However, his chronic pain is solved and not controlled by other painkillers such as non-steroidal and anti-inflammatory drugs.